My name is Dr. Light, and I'll be performing your eye exam and your ear exam for you this evening. Okay? Do you wear contact lenses? You do? Okay. And have you noticed any trouble with your vision lately? Okay. Okay. So if you'd just like to look straight ahead for me, I'm just going to measure your eyes before we begin with the other tests. So I'm just going to measure these few points here. Okay. And this point. Good. And 1 and 2. Good. And 2. Okay. Alright, so I'm going to ask you to have a look at the vision chart for me. Okay. So, can you tell me what you can see? Okay. What about this line here? And what about this one? Okay. And the smaller one? Okay. Good. Well done. So, have you noticed any blurriness in your vision? Having any trouble seeing at night? Okay, I'm going to be examining the surface of your eyes. I'm going to be shining a little pen light, like so. Okay, and do your best not to look directly at the light because it is quite bright. Okay, alright, so if you just like to look straight ahead for me, I'm going to be just looking at the health of the surface of your eyes. Would you look up for me, please? Okay, good. And look to your right, this way. Okay. Good. And look to your left. Good. Can you look up again for me, please? Okay, and just look straight ahead. You focus here on my nose. I'm just going to come a little closer. Okay. So I'm noticing that, keep looking here, I'm noticing that there is a little bit of dryness, some dryness in your eyes. Okay, so do you use any sort of eye drops to help? Okay. Okay. And how many hours a day would you say on average do you wear contact lenses? Okay. Okay. All right. So I'm going to look at the surface of your eye again. I'm going to add a colored filter to show up any little abrasions or microscopic tears on the surface of the eye, okay? It's nothing to worry about. It's a routine check. going to be adding a red filter. Okay. There we go. And if you'd like to just look straight ahead for me, I'm going to be using this little light just to have a look at the surface of your eyes. So if you look to your left for me, please. To your left. Okay. Good. Very good. Keep looking straight ahead for me. Okay. And just look up for me, please. Look up. That's it. Okay, and if you look to your right. Okay, your right. Okay. Okay. Good. Have you noticed that your eyes on the sides may feel a little scratchy sometimes? I notice that you have the slightest little scratch on the side of your eyes. Okay. Now that could be from wearing contact lenses. Do you take them out at night? Okay. So it's very important to make sure that your lenses are out in the evening and that they're cleaned, right? Okay, so I'm going to add a green filter now and have a look at the surface of your eyes once again. So this one looks a little bit like you're under the ocean. So if you look to your right again for me, please. Just to your right. Okay. Okay. And look up for me. All right. Okay, good. So I'm just going to swap hands. Okay, and look to your left, please. Okay. All right, good. Okay. All right, very good. So I will apply some soothing eye drops for you and then give you some to take home. Okay. Now, as far as the little micro scratches go, I would recommend taking a break from contact lenses for about a week. Okay. Do you have your glasses? You do? Okay. So I recommend that you wear your glasses for about a week, and then if you continue to feel the scratchiness on the sides, do come back in and I will do more investigating, okay? The last thing that we want is for there to be any infection. Okay, alright. Okay, so I'm going to hold up a series of shapes. Okay. And what I'd like you to do is I'd like you to follow the shape with your eyes. Okay, I'm going to be placing a little light behind the shape, like so. Okay. And what I'd like you to do is I'd just like you to follow the light as you trace the shape. Shall we do the first one? Okay. Well, now that you've seen the triangle, we'll start with a different shape. So let's start with this one. What shape can you see? Okay, very good. So I'd like you to please follow the light as you trace the shape on the page. Okay. Okay. What shape do you see? Very good. It's a slightly misshapen heart. Alright, so if you'd like to please follow the light. And the last shape that we'll be doing this evening. What is it that you see? An inverted triangle. Good. So if you'd like to please follow the shape with your eyes. Okay, good. So now what I'm going to do is I'm going to apply some eye drops, one at a time. And these eye drops will be quite soothing, but they'll also allow me to see into the back of your eye. Okay, so they are going to widen the aperture of your pupil ever so slightly so that I can see the health of your optic nerve. Okay, alright. So it's nothing to be afraid of. It's a standard procedure. So just lean slightly back for me. There you go. And if you look up to your right, look up for me. Okay. Good. And if you look up to your left for me. Okay. There we go. Okay. So just close your eyes for a moment, just to allow your eyes to adjust. Allow the drops to do their work. Okay. Good. And there shouldn't be any uncomfortable sensation. Do let me know if you experience any discomfort at all. Okay. Okay, you're doing okay? Wonderful. Alright. So I'm going to use my ophthalmoscope here. And I'm going to come a little closer to you if that's okay. Okay. And I'm going to be looking into the back of your eye, just to look at the health of the eye. Okay? So if you just hold nice and still for me. Going to come a little closer and a come a little bit closer still. Okay, you're doing very well. Alright, so now there's going to be a little click sound, and that's just the magnifying glass zooming in. Okay, just to have a look and magnify all of the blood vessels around the optic nerve, having a look at the health of the eye, just making sure that everything is as it should be, nice and healthy, nothing to worry about. Alright, good. Okay, so I'm just going to move away. Okay, good. So everything looks healthy and I'm pleased with that. Good. I'm going to look at the other eye now. So just keep looking straight ahead for me as you did last time. Good. And I'm just going to come ever so close, a little bit closer. Okay. A little bit closer. A little bit closer to you. Okay. So I'm going to zoom in now. Okay, just check here. Okay, good. Alright. So, just moving away. There we go. Alright. So, that all looks healthy. Alright, so I'm very pleased with the health of the optic nerve. Okay, that's looking good. The only thing that I'm going to do now is I'm going to treat the dryness and the microscopic tears that I saw on the surface of the eye. Okay. So I'm going to be adding some medicated drops to this little piece of cotton wool. Okay. And then I'm going to be wiping it ever so gently over the surface of your eyes. Okay. Now that will slowly seep in through the eyelid to treat the dryness and to treat the little microscopic tears on the surface, okay? Okay. So, just placing a little drop or two here on this little cotton wool pad. So, close your eyes for me, please. Okay, wiping here. Okay. Okay, and I'll do the other eye as well. Just ever so gently. Okay, now I'm going to be examining your ears, okay? So I'm going to adjust my tools. Okay, so have you been having any trouble with your ears lately? Your hearing's okay? Do you mind if I have a quick look at your ears? Okay. Have you had any injuries, any infections, anything like that I should know about? Okay. Any issues with your balance at all? Any vertigo, anything like that? Okay. So I'm going to have a look inside your ears with my otoscope, okay? It shouldn't be any discomfort at all. Do let me know though if it feels tender. Okay, so I'll start on your right hand side, and as with the eye test, I'm just going to come a little closer and just take a look inside your ear, make sure that everything is as it should be. The health of the eardrum looking good. Okay, I can see that you've recently had your ears cleaned. Very good, alright. Okay. Okay, alright. Good. So I'm going to look at the other side, okay? And as before, I'm just going to come a little closer. There we go. Just going to have a little look here. And everything is as it should be. So just checking here. Okay. I can see that possibly in the past you had some ear infection. Do you remember being treated for it? Do you remember getting antibiotics? Okay. Okay. Just take a look at that. All right. Okay. So your ears are in good health. I'm going to do a hearing check for you. Okay. So I'd like you to please close your eyes for this test. That's it. And I'd like you to tell me whether you hear the puffs of air on your right or on your left. So good. And what about now? Good. Okay. So I'm going to be using a tuning fork for this next hearing test. Okay. And once again, I'd like you to tell me if you can hear the sound on your left or on your right. Okay. Okay, what about now? Okay. So I'll try one more. Okay. 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 Good. So for this next test, I'm going to be whispering in your ears, and I'd like you to tell me when you can no longer hear what I'm saying. Okay? So the whisper is going to diminish in volume, and I want you to tell me when you can no longer hear anything that I'm saying. Okay? Okay. So I'll start on your left hand side. Okay. Copper penny. Finally found. Finally. Cacophony of sound. Okay. You did that very well. I hope that this eye exam and ear exam has been helpful. Thank you for coming to see me. Take good care of yourself.